47 million worldwide have it. 7.7 million new cases are found every year. What am I discussing? Dementia. My name is Marcus Davis, and I'm here talking about dementia and Alzheimer's. There's a huge difference. Dementia is the vast umbrella of all that pertains to that, and Alzheimer's is a subsection of that umbrella. Alzheimer's and dementia are roughly found in older people. When I say older, we're talking about ages 70 on up, but we do have people who have rapid stage dementia, which forms at a younger age, and that age can be as young as 40, and it causes you to lose memory. You'll have psychological issues, you'll have behavior issues. And one thing I've known after working in the field for 6 years is that dementia is not only hard for the person who has it, but also for the family members and the caregivers who provide the care for the person. You got to remember, you're talking about people who have been independent for all their adult life to now they're starting to decline. And the best way to describe that decline is that when you're 65 years old and you're used to doing all the things you can, and you wake up and you can't remember small things. I'm not talking about just keys, but small things like what day it is, how to tell time, when is my next doctor appointment, who is this stranger next to me. All these things come and happen when you're dealing with dementia. And it puts more, like I said, stress on the caregiver. But think about the spouse. You've been married for 40 years, 30 years, 20 years, 10 years, and the person you're living with, the person who's sleeping right next to you, does not know your name and cannot remember who you are. And think about being lost in that type of mind frame of trying to figure out who is what and what is who. One thing about dementia, what it is it eats away at your frontal lobe, what helps with your decision-making skills. And as it eats at your frontal lobe, your memories, your short-term memories are up there, and you forget the things that are important to you that you do on a daily basis. But also, you start to revert back to times that you lived. In my dementia training that I have taken on several occasions, there are cases where people would get stuck in their teenage years. 13 to 16 years old, they're waiting on their mother. Think about if you had a horrible childhood, an abusive childhood, a neglectful childhood, and that's where you were stuck at. How hard would it be for you to cope with life? A lot of people who start having these issues with memory loss and things of that nature turn to other avenues, such as drugs, alcohol, pain medication, things of that nature, to try to cope with it, but it actually makes it even worse. You can have dementia from different things as well. Head trauma can also cause it. A traumatic event can have this effect. Not only just as what they call getting old. And the great thing to know about dementia is that it's not a natural cause of getting old. This is something that is taking place inside your body, inside your brain, to try to figure out what's my next step as an adult. And think about if that next step as an adult starts to go in reverse, where you think you're 30, but you're actually 70, or if you think you're 9 and you're actually 81. The hardest part of working in that type of environment for me is for them to be trapped in this time capsule, in this pocket of time, but no way, no how, no shape, no form being able to get out. Like, this is your reality. You're going to have someone take care of you. That's in the good place. That's on the good side of things. That you have enough money put up to where you can afford to be in a place where they treat your diagnosis and help you with the disease, whether it be drugs, whether it be therapy, and things of that nature, and allowing you to age gracefully. But what if you're one of those people who don't have insurance, who don't have long-term care insurance, or don't have a VA benefit, or don't have the money or the means or the retirement to pay for this? Who takes care of those people? There's hospitals filled with this, with these same people, same issues, do not have the money or the means to take care of this. Think about when police is called to a situation and someone has dementia and they don't know it, they can't recognize it. People are undertrained, undereducated about dementia. I think this is the time where everyone needs to think about, I'm getting older. What do I need to know about getting older? And I think the one key thing that you should always tuck in your head, in your underneath your in your mental Rolodex, in somewhere, some shape, some form, find out about dementia. Find out if it's hereditary. Sometimes it is, sometimes it's not. It's just there's no pattern that's woven that says this is how it goes. But you need to look at your history. You need to start getting checked and make sure everything is okay. And if everything is not okay, are you prepared for that? There are a lot of people who end up broke, lonely, and old, and with dementia or Alzheimer's, and no one to turn to. Could that be you?